It's obvious that the more you test, the more you can be aware of your COVID status and prevent the spread. That is an obvious fact that we have all learned in the last couple of years. So obviously, the more testing that we do, the safer that the community can be. And there is no doubt that LFT home testing will help people to understand what their COVID status is. So it can only be helpful for the community.
The government's rationale is that Gibraltar is different to the UK and to Spain and to other countries that has a totally different set of circumstances. So what would you say to that?
It's interesting that now the government is saying that Gibraltar is different to the UK when we have practically been mirroring every guidance, directive and policy from the UK ever since the pandemic began. What is different is the fact that we are being forced to stay in the dark as to our own COVID status. I mean, you take the example of an employee who wants to take a home COVID test but can't, has to go to the PCR centre where government has admitted itself that it's overwhelmed and takes 48 hours to turn around a result. You have that employee halted completely, his employer, her employer halted as well without having an idea of how to proceed with their lives, and all it's going to do is put them off from taking tests and probably going out to the community, possibly with symptoms, and reinfecting and passing on the virus. How on earth can that be a positive step for our community? At the same time, don't forget that the government has just days ago cancelled a demonstration because they don't want people to pass on the virus. Yet what it's saying is to put all the burden on the medical professionals who are going to be having to test all these people who could be having their tests at home. Why? Because the government doesn't trust people. So instead, the only option that we have is the unaffordable £30 LFT test that we have to do in the airport, which costs around 15 times what an LFT test costs just across the border. So can you imagine that for the value of one test that a Gibraltarian takes in the airport, we could be doing 15, we could be testing every day at home for 2 weeks. It doesn't sound like the strategy is one that's set to succeed at all. And I think that we have to be asking ourselves and the government, the question is, what is the real reason for this ban? It seems that ironically, the only logical answer to that is economic interest, because otherwise the government actually, if they don't want people to test on their own, they should be providing these tests at cost. But unfortunately, all we have is a ban from government, which is an insult to people's intelligence and capacity, hampering their personal freedoms, and of course causing the virus to spread much faster. And I think the government owes people an explanation on this strange and suspicious policy decision that they've taken, and I think that they should overturn it as soon as possible in the interest of public health and public safety.
But they have given an explanation, haven't they? They've said that they've been listening to public health advice.
It's interesting that they say that they've been listening to public health advice, actually, when our previous public health director, who only recently got honoured with a medallion from Parliament, is actually also saying the opposite. So what public health advice are we listening to? Like I say, in the UK, the public health advice is to test at home, and only until days ago, because of the amount of cases that they are, the tests were free in all pharmacies across the UK. So that is actually the question: what public health are they listening to?